Your heart occasionally skips beats or races unexpectedly during routine daily activities like climbing stairs or lifting groceries. Your pulse feels different when you check it during quiet moments, but you cannot identify exactly what has changed. Your energy levels drop noticeably by mid-afternoon, even though you slept well and ate properly throughout the entire day. You dismiss these symptoms as normal aging, but they could signal a dangerous heart rhythm disorder requiring immediate attention. Your heart may be beating in deadly chaos right now, while you feel completely normal and go about your day. Your irregular heartbeat silently forms blood clots that travel directly to your brain and cause devastating strokes within hours. Your risk of stroke increases by exactly 400% when atrial fibrillation goes undetected for months or years. Your own two fingers and a simple watch can screen for this irregular pulse pattern at home today. Your doctor will never teach you this essential technique, so today I will show you exactly how to do it.
This video is for educational purposes only and does not replace professional medical advice from your doctor. An irregular pulse is not always atrial fibrillation. Occasional extra beats, called ectopics, are common and usually benign, but the character of pulse irregularity in afib is distinct. It is irregularly irregular, with no discernible pattern or rhythm to the variation. Manual pulse palpation has been validated as a screening tool for afib. Sensitivity ranges from 87 to 97% when performed correctly. Today, I explain the correct technique, what to feel for, and what to do if you detect something that concerns you.
Number 2. What an irregular pulse actually is. Understanding what produces the sensation under your fingers makes it far easier to recognize when something is wrong.
In normal sinus rhythm, the heart beats in a regular sequence. This is driven by the sinoatrial node, the heart's natural pacemaker. Each beat produces a pressure wave that travels through your arteries and is palpable at the wrist as a distinct, evenly spaced pulse. In atrial fibrillation, the atria fire chaotically at 350 to 600 impulses per minute. The atrioventricular node allows only irregular fractions of these impulses to reach the ventricles. The result is a completely irregular ventricular rate that produces pulse beats with varying strength and unpredictable timing under your fingers. Occasional ectopic beats are premature atrial or ventricular contractions. They produce a regular rhythm interrupted by an early beat, followed by a compensatory pause. Afib feels like sustained, completely unpredictable chaos in the rhythm. No two intervals feel the same, and there is no pattern whatsoever across a full minute. A study published in Family Practice confirmed that trained manual pulse palpation detected afib. It achieved 87% sensitivity and 81% specificity compared to simultaneous ECG. The 2-minute radial pulse check protocol is used in UK national screening programs. It achieves sensitivity above 90% when performed in a resting, quiet state.
Number 1. How to perform it correctly. The technique matters. A rushed or incorrectly positioned pulse check will miss the irregularity you are looking for.
Sit quietly for 5 minutes before beginning your pulse check. Physical activity, anxiety, and caffeine all transiently increase heart rate and can mask irregularity. Place your index and middle fingers on the inside of your opposite wrist. Press gently just below the thumb side until you feel a clear pulsation. Count and feel the rhythm for a full 60 seconds. Do not use 15 seconds multiplied by 4, which is too brief to detect irregularity reliably. During those 60 seconds, ask yourself, is the rhythm regular and evenly spaced, or does the timing feel completely unpredictable and chaotic? A single early beat followed by a brief pause and then return to regularity is almost always an ectopic beat. This is common, usually benign, and not afib. A rhythm that feels completely disordered throughout the entire 60 seconds warrants medical evaluation. No pattern at any point means you should see a doctor the same day. If you detect a persistently irregular pulse, do not wait. Contact your physician and request an ECG promptly. A single ECG during a symptomatic episode is definitive. It takes less than 5 minutes in any clinical setting.
By the way, I covered other crucial details on this topic in my full video, Physiology. The link is on the channel. If this helped you, subscribe, leave a like, and drop your question in the comments below.